случае потом можно переисправить. Так, все, сейчас я еще раз зайду.
Давай, я
можете пока
полный экран включу.
Да, я сейчас подключу.
Student, I have been a technical mistake, and now I repeat the start of surgery. Student, phases of surgery is a very important definition, and phases of surgery divided into 3 groups. The first group is pre-operative periods, second intra-operative periods, and third period is post-operative period after the surgery. And now let's describe the pre-operative period. Pre-operative period is a period from the arrival moments of the patient in surgical department of a hospital prior to carrying out surgery. At that time is carried out by a complex of the action directed to preparing of the patient for operation. Duration of the preoperative period depends on the degree of urgency of the operation, the patient's condition, his age, and the severity of the upcoming surgery. Only emergency urgent operation carry out according to vital indication. For example, severe injuries, wounding of the leg vessels, acute appendicitis, strangulated hernia, ectopic pregnancy, perforated gastric ulcer, acute intestinal obstruction. Are allowed with minimal preparation from several minutes to 1-2 hours. As the delay in the operation in such cases threatens the life of the patients. Student, all surgical intervention may be divided on 2 groups. It's self-surgery. 2 groups, urgent and planned. In turn, all urgent surgery may be immediate, urgent, and deferred. Now, for example, in this slide, you can see the planned surgery. For example, you can see in this slide the hernioplasties. When the patient has a hernia, this patient needs to surgery. Its surgery are called as a hernioplasties. Next planned surgery, joint implantation. Some patient with cox arthrosis need to this surgery. And in this slide you can see the implant. In here, implant. And this surgery called the joint implantation. Prosthesis of the vessels. Two is a planned surgery, and in this slide you can see the prosthesis of the vessels. So for example, it's prosthesis in here. Preoperative periods, specialities conventionally divided into stages. Diagnostic preparation and preoperative preparation involve the following task. The first task is accurate diagnosis of the underlying pathology. Second, the definition of indication for surgery and emergency surgery. Third task, assessment of the state of organs and system of the patients. Next task, implementation of general somatic training. Next task, preoperative periods, providing physiological assistance, special training in the presence of indications. And final task is direct preparation of the patient for surgery. Its main aims and main task for preoperative periods. Student, in this slide you can see, as I told you, all surgery can be divided to three groups: immediate, urgent, and deferred surgery. And in this slide you can see the immediate surgery. What is it, immediate surgery? Now, for example, the patient has the obstruction of airways, for example, trachea, and this patient need to immediately perform surgery. And in this slide you can see this surgery. Now you can see incision of the skin of the trachea, incision trachea. And in here you can see introduce the tube, tracheostomy tube. If your patient has the obstruction of airway, and this surgery need to perform very immediately. No, some minutes. Next operation, depending related to the urgent operation. And for example, you can see in the slide the appendectomy when the patient have appendicitis. And next, is the first picture. You can see appendectomy. And second pictures, you can see the suturing of stomach ulcer. It's perforate stomach ulcer, and this ulcer need to suturing. And you can see in this slide suturing of this ulcer. Let's repeat, it's urgent operation. Okay, next type of surgery. Let's wait 4 minutes. Okay. It's an example of different surgery, and you can see in the slide the limb amputation. Why this patient need to limb amputation? This patient have the vessels damage. For example, very commonly patients with diabetes have the angiopathia, the lymph vessels, and the result of this damage of vessels, it's necrosis, gangrene of the limb, and when the patient has the gangrene of the limb, this patient need to limb amputation. It's a different surgery. Okay. In patients with acute appendicitis, strangulated hernia, with an ectopic pregnancy after examination, and consent to the operation. Preoperative preparation is limited to the administration of morphine and cardiac agents. Patients with severe trauma, wounding of large vessels are treated with anti-shock therapy. In case of intestinal obstruction, physiological solution, for example, this 5% glucose solution, is infused before the operation. Patients with perforation of the abdominal organs are injected with serum, plasma, or proteins blood substitute. Before operations performed under general anesthesia, gastric emptying with a probe is often required. And in case of acute intestinal obstruction, siphonectomy is also required. It's performed before the operation and pre-operative periods. With the so-called planned non-urgent operation, the main task of the pre-operative period is to minimize the danger of the oncoming operation. For this purpose, a system of measures aimed at preventing complication during and after the operation is carried out. Activities in the preoperative periods begin with the detailed study of the disturbed function of the body in order to normalize them. Conduct an comprehensive examination of the patient using modern diagnostic techniques with an assessment of the general condition of the body and the function of individual organs and systems. The more severe the disease, the more difficult the oncoming operation, the more time is required to determine the patient's endurance and the condition of these vital organs. These examinations serve as the basis for pre-operative treatment measures, as well as for the surgeon to decide on the plan of operation and especially on the choice of anesthesia methods. The preoperative periods for non-urgent operations, for example, appendectomy in the cold period. Appendectomy is an acute period, need to urgent operation. But appendectomy in the cold periods and hernia need to non-urgent operation. Now let's repeat the preoperative period for non-urgent operation, appendectomy in the cold period, and hernia usually takes 2-3 days. It takes 10 to 30 days to prepare patients for pulmonectomy about the suppurative process of the lung with symptoms of severe intoxication. All patient with effusions is cancer of the esophagus and lung. Preparation for the operation is carried out strictly individually and include a number of general and special measures. These measures is general mandatory for each operation. Special, it's needed only in preparation for certain operations. General measures are aimed at improving the patient's neurosomatic condition, increasing the body's immunobiological state, fighting secondary anemia, dehydration, intoxication, and natural decline. A number of patients undergo special preparation for surgery in a specialized department, clinic, hospital. For example, the patient with stereotoxicosis. It's a large of thyroid glands. It's performed this in endocrinology departments. With congenital and acquired heat defects in cardiac clinics. Patient with diabetes, lung disease, is in the relevant departments. The joint work of the surgeon with specialties from related this keepness improved the quality of diagnosis and preparation of patient for surgery. Now, itself surgery. Student, as I told you, all surgery divided to planned and urgent surgery. And urgent surgery divided to immediately, urgent surgery and deferred surgery. After surgery, the patient has the post-operative periods. Post-operative periods begins after the transfer to the post-anesthesia care unit. No, post-anesthesia care unit, like emergency care unit, and terminates with the resolution of the surgical sequelae. It is quite common for the very last of this period to end outside of the care of the surgical teams. It is uncommon to provide extended care past the discharge of the patient from the post-anesthesia care unit. Student, in this slide you can see the duration of this post-operative periods. Post-operative periods divided to immediate periods. Duration of these periods 1-3 days after surgery. Next periods early periods. Duration of these periods 3-5 days after surgery. And late periods from the 3-5 days after surgery to discharge of the patient from the hospital. And all this post-operative period have the complications, and you must know this complication. Student, immediate stage, immediate period have the next complication. The first complication, very difficult complication, primary hemorrhage, starting during surgery, or reactionary hemorrhage, following post-operative increase in blood pressure. Replace blood loss and may require return to treat to re-explore the wounds. Next mediated complication in basal atelectasis, minor lung collapse. When the size of the lung decreases. Next mediated complication is shock. The cause of the shock, the first, blood loss, acute myocardial infarction, pulmonary embolism, or septicemia. Next mediated complication, low urine output, inadequate fluid replacement intraoperatively and postoperatively. It's a complication of immediate stage, immediate periods, postoperative periods. Next postoperative period called as YOLI. And in the slide you can see this complication of YOLI periods. No, the first complication is pain, after surgery pain, acute confusion,